आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर जॉइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज एफपी लाइव सेशन. Indian origin folks living in US. If parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobalDoctors has your back. eGlobalDoctors have started a new diet consultation, nutrition, and health. No insurance is needed. Reach out to the fast-growing eGlobalDoctors network. If you are living in US and your parents live in India, you can now consult doctors in USA. eGlobalDoctors have dedicated diet plans that includes Indian food. Yes, you heard it right. You can now diet while eating your favorite Indian food. If you're struggling with diabetes, thyroid, and want to join detox program, there are three different kinds of programs. Free diet consult, which is free of cost, 3 weeks program, and 3 months program along with dedicated coaches. Register today at eglobaldoctors.com and book your appointment to get a proper nutrition coaching. In today's Facebook Live session, we will be exploring and providing more information about brain cancer in conversation with Dr. Anup Katyal. Without further, let's welcome Dr. Katyal. Dr. Katyal is an ICU critical care expert, board certified in 5 specialties: internal medicine, sleep medicine, critical care medicine, neurocritical care medicine, with over 25 years of experience. It's really nice to meet you virtually, and thank you for sparing time. How are you doing this evening, Dr. Katyal?
I'm good. Thank you so much.
So what do you say? Shall we dive into today's topic?
Sure.
Okay, so my first question, for the listeners who are joining us right now, we are live to you on Facebook and Instagram. So please hop on your social media and learn more about today's topic. So what is actually brain tumor?
So brain tumor is an abnormal growth in the brain, as the name suggests. And when we say brain tumor, it could be a benign thing or it could be a malignant thing. So that is what we call a brain tumor.
A tumor. So something which does not belong is actually finding its home.
Exactly.
Okay. So how common are brain tumors and can they be fatal?
So brain tumors, if you look at the incidence of brain tumors, it's about like 30 per 100,000. And definitely, again, as I said, the tumors can be benign or they can be malignant. If it's a benign tumor, like most people have heard the term meningioma, it's a very slow growing benign tumor. It usually is not fatal. But on the other hand, if you have a malignancy, whether it is a primary CNS malignancy or it's a secondary malignancy, that is, the tumor did not arise from the brain, but somewhere else, then obviously, it can be fatal.
Interesting. So as the name suggests, brain tumor. So is it okay to assume that they will only be located up in the brain or they can be found someplace else in our body?
So again, as I said, if the tumor is a primary brain tumor, like I mentioned, meningioma, sometimes people present with, ringing in their ears and a sort of unsteadiness. It's an acoustic neuroma. Sometimes we say craniopharyngiomas. So these would be tumors or a primary CNS lymphoma, suggesting that the tumor resides in the brain itself. But when we say this tumor is secondary, it means the primary is somewhere else. So the most common tumors that spread to the brain would be renal cell cancer, cancer of the kidneys, cancer of the thyroid gland, non-small cell cancer of the lungs. And actually, the most common is malignant melanoma, which is a skin cancer. So these are cancers that arise outside the brain, but can spread to the brain. So these are not primary brain cancers, but secondary brain cancers.
Got it. So that actually is a perfect segue to my next question. So you use the word cancer, and we are also talking about tumor. So someone like me does not have enough knowledge of medical. What is the difference between a brain cancer and a brain tumor?
So again, as I said, a tumor can be benign or it can be malignant. And when we say cancer, it implies it's malignant. So it's not a benign condition. So cancer always, these are cells that divide and multiply at such a rate that it invariably, ends up being fatal. So cancer always is a much more serious thing. And again, the tumor, again, as I said, can be benign, which means I gave the prime example of something like a meningioma, or sometimes people may have heard that they have a tumor in the pituitary gland, and it's a microadenoma or a macroadenoma. And those are tumors, that control secretion of your thyroid, your cortisol, uh, other kinds of hormones, including prolactin. So they may have totally different manifestations and are managed totally differently. So.
Okay, wonderful. Thank you so much. I did not know that. So it's actually good to know. So what are the causes for brain tumor?
So we see brain tumors most commonly related to exposure to radiations growing up. Sometimes it is hereditary, and sometimes, as one ages, one is more predisposed to malignancy. Those are the three most common reasons.
Okay, so now that we know a little bit about the reasons, what are some symptoms that someone like me, like you said, ringing of the ear, that could be an alarming. So what are some other symptoms of brain tumor? And then I have a follow-up question related to the symptoms is, can someone not have any symptoms, but then all of a sudden one day find out that they have a tumor?
So as we know, brain has different parts. We say the frontal part, parietal part, temporal part, occipital part, and the back of the brain called cerebellum. So depending upon where the tumor arises or the secondary tumor, affects the brain, the symptoms would accordingly, present. But in general, if you look at people who have brain tumor, which includes both benign and cancerous growths, they present usually with headaches. And the headaches are described as like a constant dull headache. And sometimes it can be stabbing. And usually these headaches get worse at nights. And they can be woken up from sleep because of the headache. And sometimes certain position changes like bending or coughing can make the headaches, worse. Then depending upon the location, there could be vision changes. Some could have, hearing issues. Someone could have speech issues, like we say aphasia. Sometimes people have seizures as a presentation, that they have these abnormal movements we call as generalized tonic-clonic seizure or focal seizures. And when you do imaging, then you realize that there's an abnormality in the brain. And when we talk of these, we start with a CAT scan, which is a quick test. But if you are suspicious of a tumor, then you need to do an MRI with and without contrast. So to answer your question, sometimes you may get someone presenting with a headache and then say, let me get a CT scan, and you find a meningioma. So that headache was just an incidental finding, and the meningioma, which I said is a benign tumor, would have been there for a long time, and the patient may not have had any symptoms from meningioma. And someone got a CT scan just because the headache was unrelated to anything else, but you find the meningioma. So yes, you can be asymptomatic and find a benign tumor, but in general, when you have these malignancies and serious kind of tumors, then usually there are symptoms from it.
Okay, wonderful. Thank you so much. So hopefully people who are listening, you can hop on to your favorite social media, and we do questions online during our live sessions. If you have any questions, please don't hesitate and type your questions on Facebook Live or Instagram Live. So Dr. Katyal, is there a particular age or a particular age group that is more risk for the tumors or the cancers, or should a child can also have brain tumors?
Definitely, children also can have brain tumors, and actually the most common tumor in children is called a medulloblastoma, which involves the back of the brain, the cerebellum, which actually controls your balance. So those would be the most common. In addition, as I mentioned, craniopharyngiomas, which arise close to the pituitary stalk that can affect, various hormones like the thyroid hormones, cortisol hormones, other gonadotropin, prolactin. So depending upon, the exact location and what hormone is affected, children also can be affected by these brain tumors.
So you did touch upon it, but I do want to ask you that are brain tumors, is there any hereditary involved? Like if I know someone in my family had it, are there more chances of someone having it, or it doesn't matter?
Yes, no, that's a very important part of history. We do, take that into account. So there are certain tumors that do follow, if you get the family history, there is a hereditary lineage to it. But again, as I said, like other cancers, which are usually we see a lot of secondary cancers, that has nothing to do with, it's just if you have lung cancer and it spreads to your brain, that is probably related to your smoking more likely than anything else. But there is a hereditary component to certain cancers.
Got it. So, when we talk about cancers, we talk about stages. So, if you don't mind, if you can elaborate, like what are different kind of stages and what does actually mean? Which stage is considered, it's like it's too late. I have heard stuff like this. So, if you don't mind, shed some light on different stages of cancer.
Sure. When we talk of primary brain cancers, people may have heard the term gliomas, and it's actually classified WHO classification stage 1, 2, 3, 4. Obviously, stage 1, 2 would be early stages. They portend a good prognosis. Stage 3, 4 is definitely a bad prognosis. So people may have heard the term, sometimes the most dreaded tumor in the brain, like a primary CNS tumor, is GBM, glioblastoma multiforme. It's no longer called by that name. WHO, again, as I said, the most recent classification was in 2021, where they changed the staging to stage 1, 2, 3, 4. Similarly, as I said, these would be primary brain tumors, which are arising from the brain tissue. Then there is what I mentioned, CNS lymphoma, which is again a kind of cancer which does not portend a good prognosis. Then I mentioned that people a lot of times have secondaries. That is, whenever we say anyone with a tumor in the brain, our next step is to do a CAT scan of the whole body. And the whole purpose of doing a CAT scan is, if someone is a smoker, do you see a nodule in the lung that may be suspicious? So this is lung cancer, and probably what we are seeing in the brain is metastatic disease. A CT scan of the belly may show up, a cancer involving the renal cell, the kidneys, which we call as most common renal cell cancer. You see a growth on the kidneys that may be suspicious. So obviously, if someone has a cancer which is secondary, that means the primary is outside the brain. By default, since it has already spread to the brain, it is stage 4 cancer. So it has spread way beyond its origin, and that also portends a very poor prognosis. And the treatment is guided more towards palliative care, and rather than it won't be curative. So there is treatments like chemotherapy and radiation therapy that one can offer with the intent of prolonging someone's life, but certainly it won't fix the problem.
Got it. That's actually good to know. So for the people who are joining us, we are live to you on Facebook and Insta page. So hop on your favorite social media where we bring to you new and interesting topics. And we are talking in conversation with Dr. Katyal about brain tumors and cancer. So my next question, the treatment that we were talking about, what are some treatment of brain tumors? Like if somebody finds out in the first stage or the second stage, what could be done to make sure that if it's not 100% gone, it doesn't keep coming back?
So that's a very good question. That part of my specialty in neurocritical care, we see these patients all the time, that we find that there's a growth. So the first step is, as I mentioned, a CT scan may suggest that, but if you're suspicious, an MRI with and without contrast is done. The next step is, the neurosurgeon is involved. So they make their best effort to resect the tumor as much as possible. And when they are doing the surgery, depending upon the location, you'll be surprised a lot of places do awake surgery, because if this tumor involves your area of the brain that controls your movement, you don't want to damage the so-called normal tissue. So you'll be surprised people are undergoing brain surgery with electrodes and seeing the movement. So you don't want the normal tissue being affected. So when the surgeon looks at this, neurosurgeon, we do something called as a frozen section, that as soon as the tissue is taken, there's a pathologist in the operating room who looks under the microscope and says, this is what it looks like. It's a very preliminary, finding. And so depending upon the location, the neurosurgeon will try and resect as much tumor as possible. And then they come to the ICU. When they come to the ICU, obviously our concern is that could they have a seizure? And a lot of times when you have cancer or tumor in the brain, it produces surrounding swelling or edema, which in medical terms we call vasogenic edema. So you'll see a lot of these people on steroids called Decadron, and the whole purpose is to decrease the edema. So those are the two things we take care of. And then sometimes there could be increased pressure in the brain, and which we have ways of reducing through medications. And sometimes we have to put a drain in the brain to take care of it. So after resection, once we get the final pathology, we do involve radiation oncology. So these are the doctors who would provide radiation to the brain to kill whatever tissue, that one did not get. And there are different kinds of radiation, whether it is whole brain radiation, selective radiation, gamma knife, and so forth. And depending upon the nature of the final tumor, we may involve hematology oncology too. So those would be the doctors, guiding whether there's any chemotherapeutic agent to be offered. So it's a multi-disciplinary approach, involving the neurosurgeon, radiation oncology, and the hematology oncology, in addition to the fact that when they have the resection, they will be in the ICU for a short period of time.
Wow, that's a lot of people are involved, and thank you so much. That's why you are the subject matter expert. So hopefully nobody has to go to that stage, but if someone is there, then we know that Dr. Anup is there to take care of them. So thank you for that. We were talking about treatments. I wanted to ask you, are there any preventive measures that one can take after they have been diagnosed with the tumor or the cancer?
Once you've been diagnosed, then, the treatments that are offered, one has to look at the functional status of the individual, the age of the individual, what's the ability to take chemotherapy, because a lot of these medicines are harsh on your body. So again, as I said, depending upon the stage of the tumor, early stage primary CNS tumor, stage 1, 2, you resect and you're good, basically. But if it's advanced, then certainly you have to have the approach of radiation, chemotherapy. As far as once the diagnosis is made, then it is just basically depending upon the stage and depending upon whether it's primary or secondary, the treatment modalities are then targeted accordingly.
So any lifestyle changes, like, of course, we need to look at individuals' health and the age, like you mentioned, but any lifestyle change like diet, exercise, and then the follow-up question is, if the person is doing what the doctor has suggested, but still it's worsening, then what is the remediation for that?
As far as a lot of times when we see these cancers in the brain, they are secondary cancers, right? So like, again, I mentioned cancer originating from the lungs. So what one can do, obviously, smoking is a big risk factor. Exposure to pollutants is a big risk factor. When I talked about, renal cell cancer or cancer involving the kidneys, again, smoking is another risk factor. Exposure to certain dyes is another risk factor. When we talk of malignant melanoma or skin cancers, exposure to too much of sunshine and so forth. So those are some things that one can certainly employ to prevent the cancer in the first place. Unfortunately, once the cancer spreads to the brain, you can offer is palliative. And now we have, newer agents and radiation. So the lifespan has increased. But in general, when you say stage 4 cancer, that in some ways does not portend a good prognosis.
Wonderful. Thank you for sharing that. So, what is the survival rate of brain tumor?
Again, as I said, depends on the type of the tumor and depends on the stage of the tumor. For example, when I talked about, GBM, old glioblastoma multiforme, average life expectancy was in weeks. People survived 6 weeks to maximum 6 months. So it depends what kind of tumor you're dealing with, and then one can come up with. And again, as I mentioned, if it's a secondary tumor, that always means that, if it has spread to the brain and the primary is somewhere else in the body, this is already stage 4, where,
Mhm.
the prognosis is not good. So it depends on what kind of tumor one is dealing with.
Okay, and when did we find about it?
Exactly.
Okay, let me check if we have any questions for our Facebook Live and Insta Live. I don't see any questions. So with that, Dr. Katyal, it's a wrap for our today's session. We appreciate you always coming up, sparing us some time, and giving us the information, which is really, really important, so we can do the needful before it's too late. So I do want to tell our listeners that if you are worried about your medical needs in USA, check out various health packages that eGlobal has to offer: bronze, silver, and gold. What are the benefits of having a health package? They are introducing deals for you and your family members. You can get consulted at a lower rate. Choose from their board certified doctors, USA and India. Prescription will be provided. Their specialist, number of special services. They have video consultation up to 30 minutes, and packages can be used by yourself or your family members. Response time is 1 to 3 days. Like I mentioned, eGlobalDoctors have started new diet consultation, nutrition, and health. No insurance needed. Reach out to the fast growing doctors network in eGlobal. If you are living in US and your parents are living in India, you can consult a USA doctor. eGlobalDoctors have dedicated diet programs that include Indian food. So yes, you heard it right. You can diet and eat your favorite Indian food at the same time. If you are struggling with diabetes, thyroid, or you want to join a detox program, there are different kinds of program: free diet consult, 3 weeks program, and 3 months program, along with dedicated coaches. Register today at eglobaldoctors.com and book your appointment to get a proper nutrition. So before I let you go, Dr. Katyal, any word of wisdom you want to share with our viewers?
Again, as you mentioned, with these kinds of things, prevention is always better than cure. So again, as I said, if it's primary CNS, probably one doesn't have much in control. But when you have these secondary tumors, whether it's lung cancer, renal cell cancer, certainly, avoiding smoking, avoiding pollutants certainly would go a long way in improving one's health.
So there you have it. Prevention is better than cure. With that, this is Kunjan signing off. Sayonara till we meet again. Stay tuned, stay safe, and keep smiling always. Thank you, Dr. Katyal.
Thank you so much.